Hello, my name is Brian Moores. I am a weight loss surgeon at Bariatric Medicine Institute in Salt Lake City, Utah. Congratulations on making it to your pre-op visit with our group. Today I'd like to just summarize some of the pre-op, hospital, and post-op care for your weight loss surgery. The goal of this video is to briefly summarize some of the common questions that we get asked during this visit and to serve as a resource for you moving forward if you have questions. Your best resource for questions, though, is the guide provided to you by our office, as it has the most detailed information. Let's talk a little bit about surgery. Things I'd like to review are when your surgery will be, what to expect on the day of surgery, and then what the risks, benefits, and alternatives to surgery are. So we operate at 4 facilities: Holy Cross Salt Lake, City Creek Surgery Center, LDS Hospital, and St. Mark's. These facilities will call you 2 to 3 days before your surgery, and they'll tell you what time to show up for your procedure and what time your procedure is. We want to make sure that you take your pre-op medications 2 hours before your scheduled surgery time so that you can absorb those medications and prevent pain, inflammation, and nausea. Next, I'd like to talk a little bit about surgery and what to expect. Surgery for a sleeve gastrectomy will take approximately 45 minutes, and the duodenal switch will take approximately an hour to an hour and a half. You can double that time for the time that it takes to go to sleep and wake up. So on average, your family for a sleeve won't get to see you for an hour and a half to 2 hours, and for a duodenal switch between 3 to 4 hours. After surgery, you'll be admitted to the floor in the hospital for 1 day. Most patients, the first day is just about recovery, breathing deep, going on some walks, and getting up to urinate. The second day in the hospital, which is when you'll be going home, you'll start on liquids, oral pain medications, and you'll have your drain removed from your incision, which is used to monitor for bleeding or leaks. One thing that we should talk about with surgery are the risks, benefits, and alternatives. At this point, you've made it to surgery, so the alternatives are not very important to talk about today, but long term, there are alternatives to surgery, such as diet and exercise, weight loss medications, and revision weight loss surgery. Some of the risks with the surgery are generic to any surgery. So there's a 1 to 2% risk of infection or bleeding. With anesthesia, there are risks of heart attack, stroke, blood clot, an allergic reaction to a medication, or problems with anesthesia. Long-term with weight loss surgery, there's always a risk of weight regain. And this is specific to your weight, your metabolism, and what surgery you pick. Your provider can talk more with you about this risk. Other risks are developing heartburn, either temporary or permanently, or requiring additional surgery for heartburn. And then some of the most common risks kind of in the immediate post-surgery period are developing nausea, anorexia, heartburn. Usually medications help treat those things, but sometimes people will need temporary feeding tubes down the nose if they're not able to eat or drink well on their own, or they may need rescue IVs in the arm, such as PICC lines to provide nutrition. Other scary things are if connections leak or if connections are too narrow. That's a 1 to 2% risk. Those complications do require additional treatment and management. Lastly, long-term for the duodenal switch, there's approximately a 5% revision rate for kind of a group of issues such as life-altering diarrhea, vitamin deficiencies, protein or iron deficiencies, developing problematic bile reflux, or again, heartburn. All right. And then some of the key benefits to this surgery are obviously decreasing your weight, improving your health, resolving high blood pressure, diabetes, and decreasing your risk of major heart attacks, as well as decreasing your risk of cancer.